If you say, I'm sick at the emergency room, you're not giving the doctor enough information. Worse, if you say, I am pain, you're making a common but confusing grammar mistake that could slow down your care. Stop saying, I am pain or my head is exploding. Native speakers don't use those phrases. In this video, we are going to fix the 5 biggest mistakes students make at the doctor and give you the natural alternatives. We see these mistakes all the time. Today, we'll fix your grammar regarding body parts, fix how you describe time, and correct the symptom versus disease confusion. By the end, you will sound like a pro. Let's clean up your English. Welcome to Pocket English. I'm Sarah.
And I'm Mark. Today, we are focusing on clarity and confidence. These 5 mistakes are so common because they are direct translations from other languages, but they just don't work in English medical contexts.
Mistake number 1, confusing the verb to be with the verb to have. This is the classic I am pain.
Yes, Mark, this is probably the biggest grammar blunder, and it causes huge confusion. If you say, I am pain, the doctor might literally think you are introducing yourself as the feeling of pain. It sounds alien. In English, we use to be to describe feelings or conditions, but we use to have for symptoms, illnesses, and injuries.
So the rule is simple. We have symptoms. We are in a state or condition.
Exactly. So instead of saying, I am fever, the correct phrase is, I have a fever. Instead of, I am cold, which sounds like you feel chilly, if you mean you have a sickness, you should say, I have a cold.
Here are 2 essential corrections. If you want to talk about pain specifically, you say, I am in pain, or the much simpler, more common phrase, I have pain in my back, or my back hurts. Remember that difference. I have a symptom, I am in pain. Repeat that after me. I have a symptom. That's your first win today.
Mistake number 2, using body parts incorrectly with verbs. Learners often translate directly, leading to phrases like, my stomach is paining me, or my head is throbbing me. While technically understandable, it's not native English.
When we talk about pain, we use the verb to hurt, or we use a common structure that starts with I have a. Let's break this down. If the pain is the subject, use hurts. For example, my knee hurts, or my throat hurts.
If the pain is ongoing, I have a sore throat.
That's a great distinction, Sarah. The word sore is often overlooked. We use sore specifically from muscle and throat pain. So never say, my throat has pain. Say, I have a sore throat. Never say, my muscles are paining me. Say, my muscles are sore. Also, think about location. We use prepositions like in or on. I have pain in my chest. I have a rash on my arm. Don't forget those small words. They add massive clarity. For practice, try this. Describe a toothache. Instead of, my tooth has pain, say, I have a toothache, or my tooth hurts.
Perfect.
Mistake number 3, confusing the duration of a symptom. Many students misuse the word since when they should be using for. This is a subtle grammar error, but it drastically changes the time frame the doctor hears.
Absolutely crucial. The doctor needs to know when this started. Use since when referring to a specific point in time, like since Monday or since 3 a.m. Use for when referring to a period of time, like for 3 days or for a week.
A classic mistake is mixing them up. Saying, I have had a fever since 3 days. That's incorrect. You should say, I have had a fever for 3 days. Let's look at the correct structure. You must use the present perfect tense, I have had, when describing something that started in the past and is continuing now.
Correct. I have had this cough since last night. Correct. I have had this headache for 24 hours.
If you forget the present perfect, your answer might sound like it's describing a single event in the past, which again confuses the doctor. Remember the rule. Since for a date, for a length of time. We are already halfway through. If you are finding these quick fixes helpful, remember to hit that like button and subscribe to Pocket English. We drop new conversational lessons every week to give you the confidence you need in the real world. Let's jump to mistake number 4.
Mistake number 4, using overly dramatic language or false cognates. This is where the direct translation really fails. Phrases like, my head is exploding, or I am dead tired, are too casual and often not taken literally in a medical context, which can lead to misdiagnosis.
If your head is truly exploding, you should be in the emergency room immediately. But if you mean you have a severe headache, you need specific vocabulary. Using words like exploding just makes you sound vague.
Instead of drama, we use intensity. Use adjectives like severe, sharp, throbbing, or dull.
Sarah, can you give us an example? How do we replace the drama with medical clarity? Certainly, Mark. Instead of, my back is dying, you should say, I have severe pain in my lower back. Instead of, I feel bad, say, I feel nauseous, or I feel extremely fatigued. Nauseous means you feel like you might vomit. Fatigued means exhausted. These are the specific, neutral words doctors rely on.
This is a great moment to point out the difference between dizzy and nauseous. Dizzy means you feel faint or unstable. Nauseous means you feel sick to your stomach. Learners often mix these up. Practice saying, I feel dizzy when I stand up. I feel nauseous after eating. Specificity is key to proper care.
Mistake number 5. The confusion between a symptom and a disease. A symptom is what you feel: pain, fever, cough. A disease is the name of the condition: the flu, bronchitis, allergies. Students often describe the disease when they should be reporting the symptom. They might say, I have a cold in my chest. This is structurally awkward. A cold is a condition, not a physical object located in your chest. What they mean to say is, I have a bad cough, or I have congestion in my chest. Congestion is the professional term for a blocked or stuffed feeling. Another great example is the word stomach. Many learners use stomach for the whole abdominal area, but doctors need you to be more precise. If the pain is in the lower belly, say abdomen. If it's actually related to digestion and stomach acid, then use the word stomach. So when talking about feeling sick, focus on the symptoms first. Doctor, I have a runny nose and a low-grade fever. These are symptoms. The doctor will then diagnose the disease, perhaps as a cold or the flu. This is your job: report symptoms clearly. The doctor's job: diagnose the disease. Let's recap the 5 mistakes we just fixed, securing your communication skills for your next doctor's visit. First, you fixed the I am pain grammar. The correct phrases are, I have pain or I am in pain. Second, you learned the proper verbs for body parts. Use hurts for the pain and sore for muscles and throats. My tooth hurts. Third, you mastered the time words: since for a specific date, for a duration of time, always using the structure I have had. Fourth, you traded drama for medical intensity, using words like severe, throbbing, and nauseous. And finally, you understood the difference between a symptom and a disease, focusing on clear terms like congestion and runny nose. You now have the tools to correct your English and speak clearly to any medical professional. You are no longer making those confusing mistakes. You are precise, clear, and confident. To help these new phrases stick, try the mini dialogue exercise provided in this video. Listen to the doctor's questions and repeat your answers using the correct grammar we practiced today. The best way to learn is by doing. We want you to feel confident and safe no matter where you are or what situation you face. If you found this lesson helpful, please click the like button below. It helps us know what kind of lessons you need most. And don't forget to subscribe to Pocket English Podcast and hit that notification bell so you never miss another essential English skill. Make English your easy daily win. We'll see you in the next lesson.